everyone, welcome to Time to Heal. My name is Pam Hemphill, and today we have a special guest with us, Dr. Charles Rice. Dr. Charles Rice is a clinical psychologist. He's the owner and director of his own clinic, Living Hope Clinic in Boise, Idaho. Thank you for coming on today. I really appreciate this.
Well, thanks for inviting me.
I'd like to start off first by asking you, can you share with us what motivated you to even get into the field of alcohol, drugs, and therapy and clinical psychology?
Well, all behavior is multiply determined, as you probably know, so probably many reasons. One, of course, was my mother was a psychiatric nurse, and she told me about working at Shadle Sanitarium in Seattle, where, they use Emetine and counter conditioning. I had an externship there years later. And she introduced me to the psychiatric world when I was quite young. I used to go to Shadle Sanitarium where she was a head nurse and mow the lawn and play badminton with the patients and eat with them and so on. And then my half-brother was a clinical psychologist and a school psychologist. So it was kind of in the family. And so it was also a way to make money. So I decided to follow along in their examples and become a clinical psychologist. It costs a little too much money to get an MD, but after being in the military and serving a little time in Korea, I came back and used my GI Bill and went back to school. And first became a school psychologist and marriage and family and child counselor for a while, and then decided to go back because I didn't think I knew enough to really do private work independently. So I went back to Washington State University for my PhD, and then internship at University of Oregon Medical School in the VA hospital in Portland, Oregon, and eventually went to Harvard Medical School for a postdoctoral fellowship in behavioral psychology.
Harvard?
Yeah.
Wow.
Where I met my wife, a psychiatric nurse.
Oh, tell me about that.
I like to brag and say she's the only thing of any value I ever got from Harvard. She works with me at the clinic in working with families and couples and children. And she's, of course, I'm a fan, so
Yeah.
I think she's pretty sharp. And so I've been doing this for quite a while. And we had been out east, and she is from Niagara Falls herself, but it's so damp there, and we decided to move to Idaho and back out west to a higher, drier climate because the children had allergies, and I have allergies, and I'm a child of an alcoholic, and a lot of children of alcoholics have allergies, and so we came to a higher and drier climate, and it was better for the family. So I've been here for 25 years and just love it. Love the mountains. Climbed mountains when I was a kid, young man and stuff, and the altitude is good for me.
Oh yeah, it's beautiful here.
Sure is.
What I like about it the most of Boise is a family atmosphere here.
Oh, yeah, we can't be. Well, I've lived in many places, New York State, Boston, had private practice, California. Yeah, I wouldn't go back to any of them. I'm adopted, I hope.
A question I have for you, since this is a Recovery Talk TV show here about alcohol and drugs, what are some of the most recent research findings that are happening in the addiction field?
I like Dr. Dodd's book, Breaking Addiction. And correlates with another book. Now, he's from McLeod Hospital, which is the teaching hospital of Harvard, where I had my postdoc. And he's the head of the addiction place there. And he's a psychoanalyst. He describes many case studies. And there's another book similar to it by a couple of hypnotists. Interestingly enough, they say the same thing. In terms of cause, they say that people have expectations, and when they don't get those expectations met, that leads to frustrations and or resentments, and that can be displaced onto a substance. And all substance abuse is all, they say, substitutable. In other words, you can put down a drink and pick up a fork, put down a fork and pick up whatever. So it's a form of obsessive compulsive behavior, but it's less, of course, acceptable to society. But when frustrations are not met, and the person, it's like being in a cave-in, Dr. Dodd says, and the person feels really trapped, and they'll displace that onto a substance with alcohol and cocaine and meth. Those are all empowering drugs anyway, so that makes a person feel more competent and more empowered. Another doctor wrote a book, The Drinking Man, and then one of his students, The Drinking Woman, said the same thing, that drinking enhances, and of course other drugs, enhances the self-worth, self-esteem. People feel more attractive, more potent, more powerful. That's why we have a lot of, beer muscles and bar fights and stuff. But unfortunately, when the person sobers up, they're back in the cave-in. Nothing's really changed. Now, those frustrations can be from the day before, but they are the broken expectations, okay? Expectations are very common, such as, for example, you might expect, to get to work on time, but somebody cuts you off and it makes you mad and you don't get to work on time. That's a trivial example, perhaps, but there are all kinds of expectations that we have that, we plan for things to happen during our day, right? We expect to have a nice interaction with our spouse, perhaps, or our kid. And if we don't, well, that's a broken expectation, right? So that's displaced, as I said, and it can be broken expectation from the day before, but it can also be from years before. The broken expectation in the here and now, the boss yells at you, the teacher, your wife, or your husband, that can trigger other things from the past. And of course, many addicts, unfortunately, come from families in which there's a lot of addiction. There is I believe anyway, there's no proof of it, but I believe it's familial and there's a lot of genetic stuff involved there. Someday they might prove it. In my own family, my father was an alcoholic, my grandfather, my uncle, my father-in-law, everybody. It's epidemic, as you well know. It's so widespread. Anyway, getting back to the point about these expectations, of course, Dodds is a psychoanalyst, so he, in his book, and these other writers, have a list of other resources or ways to cope with these broken expectations. I myself do Gestalt therapy, which is it's a psychodynamic thing, but it helps people finish unfinished business. People can, hopefully, I don't know if it's nature or not, but one would hope that their parents would love them. And they would expect that there wouldn't be a lot of yelling, fighting, and carrying on. But in alcoholic families, there often is. And of course, there's a lot of trauma in these families. The alcoholic family system, of course, develops a stably unstable state, like a mobile hangs from the ceiling. Yeah. Touch any one part, it all moves. And so it's a highly tense, highly traumatic environment. Kind of obviously, I mean, I don't have to tell you that the person whose brain is compromised by alcohol, judgment is not good, control of basic instincts like aggression or sex are not good, and people get hurt. Spouses get hurt, children get hurt, dogs and cats get hurt. Yeah. I mean, everybody gets hurt. So anyway, so people often have a lot of trauma, which they carry from childhood, and so on. Now, these expectations of the day, or even the past, if they're not met, what happens is, during the night, people dream, because the brain doesn't like unfinished business, people will dream to try and finish that unfinished business, which is done through metaphor and simile and symbols, right? If they overdream, because they have so much unfinished business, they're going to wake up in the morning exhausted. They're working all night. and they're depressed. And that's why depression and addiction are so commonly associated, right? Because a person just can't get any serenity, any peace, because their problems never go away, not even when they're sleeping. So they don't get a lot of delta sleep or restorative sleep.
So that's why those with PTSD have all those nightmares, that it's still
Correct.
unresolved?
Correct. That's one of the reasons people have who have post-traumatic stress disorder have a lot of nightmares. They're trying to finish that unfinished business in their dreams. Unfortunately, that it doesn't finish it naturally. Yeah, there's therapeutic ways to fix PTSD.
And do you want to discuss
Tell
that?
you how to
Yes,
do
I
that?
want to know the secret.
Okay, well, one method is called eye movement desensitization response.
Yes.
It's kind of like, it's the MDR, it's kind of like a waking hypnosis procedure. The other procedure is to use what's called a rewind technique in hypnosis, okay, where it's kind of, you put the person in that nice relaxed state, and it's imagery. Again, that's the right side of the brain. And what you do is you reprogram those instincts or that unconscious mind, which resides in the middle of your head, in a place called the limbic system, and the amygdala, which has the emotions, okay?
Yeah.
What you do is through imagery, which the person, if they're dreaming, they're imaging, right?
Yes.
We know we have an unconscious mind because we dream. So what we have is, in hypnosis, kind of like a waking dream. And what you do is you take it and you have the person go through it, but you go through it really fast. And then at the end, you have them go through it backwards, really fast. That's called a rewind technique, and you kind of erase it. It's kind of like a tape. It's like erasing a tape recording, right? And there's more to it. I mean, you have to get them
Right.
watching it outside before they watch it inside and so forth. You can cure PTSD in one session doing that. Sometimes it takes more, but you don't. Just talking about it, unfortunately, often just reminds the person of it, and it re-traumatizes them over and over.
Okay.
Okay? But if you have them do this rewind technique or the EMDR, you can erase it.
Now, are they feeling any feelings or emotions?
No, they're very relaxed because they're in a hypnotic state, you know.
Okay.
That's why I like hypnosis better even than the EMDR, because you have them so relaxed that, so you can't be relaxed. When you're relaxed, the parasympathetic branch of your autonomic nervous system is engaged. To be to have a traumatic memory, put in trauma hormones, cortisol, you have to have the sympathetic branch of the autonomic nervous system engaged, right? But if you have them so relaxed, they're in the parasympathetic branch,
okay.
and you're erasing it while very relaxed, see? They can't be aroused emotionally and relaxed at the same time. It's not possible.
Because I'd heard that it's important to go back and feel what you didn't feel, what you numbed out. No? That's not what... You know, like John Bradshaw, he mentioned, he did a lot of that work where he had you go back and let the child cry and grieve.
Well, you know, you can, they call it abreaction, yeah. You can do that, and that's kind of like
That Gestalt.
implosion. There's another system called flooding. You flood the person with so
Right.
much that they get exhausted, and it's all desensitized. Okay, people can try that. I prefer not to. I mean, I do have people finish unfinished business if they're strong enough by confronting perpetrators and whatever. But if it's, you know, really bad, shoot, I mean, if we can do it easier, and if you can do it in one session, or two, or three, how much better?
So
I
you
would
meet
think.
them where they are and what's
Yeah,
more
yeah.
appropriate.
Now, if people have repressed things, okay, in hypnosis you can have them regress, and then you can have them do gestalt about unfinished business that they have confronted. Somebody who's traumatized them, beat them as a child or something, right? You can have them in gestalt while relaxed, do a kind of role play. It's called gestalt role play, and work through those feelings, and then forgive the person and move on. And yeah, okay. If the person doesn't quite remember everything. You can do that. I don't have to do that very much, because especially when people have PTSD, they remember all too well, unfortunately. Right?
I'd heard that hypnosis, that it's not, well, this is just what I heard, so I just want to hear your opinion, that we shouldn't force a memory to come up, let it come up on its own, or
Yeah, you don't want
because
to.
it could be too traumatizing.
Well, no,
for
you
them.
don't. You also don't want to induce memories that aren't there.
Right.
I mean, you don't want to suggest
Is that how
something that
that's
didn't
happened?
happen. You end up with false memories, right?
Right. Okay.
People can try and grind their own axe if they think everything's caused by trauma.
Right.
They can suggest trauma. Well, I don't want to do that.
Okay. Yeah, that makes sense.
They have to discover it on their own. I mean, I don't want to put it there.
Well, I like the hypnosis and Gestalt.
Yeah, I do too, but that's my thing. Dr. Dobbs does
Yeah.
psychoanalysis. I suppose that works for him quite well in different people. It depends on your training, of course.
Mm-hmm.
I'm just highly trained in what I'm trained in.
Yes, and I, was taught and learned to inform clients and our patients to learn about the different approaches in therapy. And they're not schooled. Well, I need a therapist that does Gestalt. I need a therapist. Is there anywhere they can go to maybe learn what maybe a layman would learn about how to pick the appropriate therapy for what issue they're going through?
Well, the ubiquitous Google, right?
Okay.
You can find out anything in today's information society on the internet that describes different procedures and what they're good for. Now, mind you, though, one wants to make sure that it's evidence-based treatment. That
And
is,
can you
there's
explain that?
research,
Research, okay.
like Dr. Dodds' research. Tons of research about hypnosis. Obviously, it's been approved by the American Medical Association for, 50 years?
Mm-hmm.
Something. But there's a lot of data. Anything that's kind of like, some people are doing this thing I've heard of called tapping or
Mhm.
whatever.
Yeah.
Well, unless there's data on it that's, convincing,
Mhm.
it's been around a while, and there's good evidence, I wouldn't try anything that's like experimental or new or untested.
Yeah, I've heard a lot, mindfulness.
Well, that's meditation.
Okay.
Of course, that doesn't, in a way, that's kind of preventative in a sense that
Okay.
there's a book called Relaxation Response. Again, the author's from Harvard. I'll remember his name is a little bit. Anyway, wired meditators up, measured their brain waves, did assays on their blood level and so forth.
Mhm.
It reduces stress a whole lot. Reduces cortisol, whatever.
So more of a tool, not necessarily the treatment, but as a tool to use to
Yeah,
reduce
it's
some
not
symptoms.
psychotherapy,
Right.
and it is different than hypnosis, for example, or other therapies. But in terms of stress reduction, it's great. Start your day that way, relaxes you during the day, and it's very very good. And there is some research. Addicts have been, research about addicts using it in a positive way to help them, and it's been good research there.
And your
Benson, that's his name. The
Benson.
Relaxation Response by Dr.
Yes.
Benson.
and your approach with anxiety and depression, what is that?
Anxiety and depression against psychotherapy. Depressed people, again, in terms of dreaming, they overdream. They have too much unfinished business, too many expectations unmet. You try and assay what needs are being met and what needs are not being met. People have needs for community, needs for purpose and meaning in their life, some control of their lives and things like that. I have a little questionnaire. If their needs aren't being met, if they don't have a support network and so forth, well, of course, you'd refer them to support networks, of which we have in our country, probably all, I don't know how many countries, but, the 12-step programs and other support programs are just all around for people, plus many, many other clubs and things that people can get interested in, hiking clubs and so forth, to have some kind of community and outlet, purposes. You know, people can find a church of their flavor or philosophy of their flavor, but people do need meaning and purpose in their lives also, some spiritual dimension to their lives, recreational dimension. What do they have and what don't they have? Because people need a little recreation too. Social life, do they have a significant other? Stuff like that. You want to find that out, and if their needs aren't being met, you want to help them meet them. And then, of course, you want to help them resolve or work through their unfinished business if they have any. Oftentimes, if they're not getting restorative sleep, hypnosis is good for that, so they can get some delta sleep. That's 4 cycles per second or slower, so they can get some rest. Cognitive behavior therapy is also used. I use that too. I was trained at Harvard in that and Washington State, where people, I have a workbook for that, people look at their thinking errors, such as personalization, self-blame, guilt, other thinking errors, and learn to dispute those thinking errors. That's for the left side of the brain for cognition, thinking, in other words. That's what cognition means. To learn to change your thinking, that's cognitive behavior therapy. And then the psychodynamic psychotherapies like Gestalt and hypnosis for dealing with the left side of the brain, or no, right side of the brain, sorry, and the unconscious mind. So we deal with both the conscious mind and the unconscious mind through a variety of strategies. Mm-hmm.
You know, in the program, when I was new in the program, and you still hear it once in a while, which we are told not to play doctor and psychologist, but you'll hear this in the recovery community. Well, all you need is the program. You don't need to be on any medications for your psychiatric problem. My understanding, however, since I've been privileged to be introduced to the program, not as as a consumer of one of them. I'm not an addict, but still there are groups for family members. I've been introduced to the program, and my understanding is that the program has no argument with other treatments that anybody might need. So I think that, may I say Bill W.? Yes.
Bill W. writes that there's no controversy or conflict, and that, as a matter of fact, in one of the brochures I read, he says that, the medical profession is going to be finding out more and more about addiction as the years go on. So we have no argument. No argument with theologians, no argument with physicians, no argument with anyone else who wishes to help us, he says. Less what? Controversy can lead us in the wrong direction. We don't want any controversy. And if that's helpful, that's helpful. And some people are dually diagnosed. They do have a mental illness, for example, and as well as an addiction. And it would be not fair to them to get the correct medication so that they can function, because they can stop their addictive behavior, but then have all kinds of very painful symptoms like hallucinations or major depression, which requires medical treatment, right?
Yes.
And with some of the modern drugs today, they can function quite well.
Oh, yes.
I'm very impressed with that.
I'd heard my sponsor several times talking to others, says, remember, Pam, it's medication, it's not drugs. It's medication. It's the God medication. Well,
and then there are those two who may cope very well in the programs with their addiction, but then they may have that unfinished business that leads them to depression, anxiety, panic disorder, and whatever, that requires psychological help.
Yeah, and she used to say, would you go all day with a headache? Why wouldn't you just take some aspirin?
Yeah, right.
She was funny. Another question I have for you today, unfortunately, me and my husband had gone to meet with this gentleman in the hospital that overdosed on heroin. He was 22. And his heart had already been damaged. And we did what we could to help him and gave him phone numbers and stayed available for him. But we didn't have any contact with him or his mother but till today. And she called us and said that he committed suicide. So for the parents and the family that are out there that have lost somebody from this addiction, what would you say to them?
Regarding suicide, which is all too common in the addictive community, but community at large as well, now that's grief, and people are going to have to learn to say goodbye to the person. Normal grieving can take 5 years without treatment, but treatment can speed that grieving process up. The stages of grieving, according to Elizabeth Kubler-Ross in her book on Death and Dying, is shock, anger, bargaining, please God, please doctor, depression, acceptance. But through, I use Gestalt therapy and even hypnosis, one can speed up that grieving process and speed up saying goodbye. Now mind you, I have a saying that I tell people, you can't say hello until you say goodbye. So one needs to say goodbye in case they want to go on with their life and maybe find another partner or have more children, perhaps, if it's a child that's committed suicide or whatever. But that's a saying I do have. And one doesn't, in saying goodbye, one doesn't have to say goodbye to everything. One can learn to, when I do it, I have the person, I kind of have them role play this, right? They keep the parts of that person, their experience with that person, they keep those parts that they like, and they say goodbye to the parts they don't like. For example, they would want to say goodbye, this person you're talking about would want to say goodbye to the way the person died, you know, to the suicide, but might want to keep a lot of other experiences they've had with that person. So one doesn't have to say goodbye to everything.
You know, we're coming to an end. Just to wind it up, the last thing that you'd like to say to our viewers. Is there anything you'd like to share with them? About addiction and, well, just a little bit on your spiritual perspective, real quick.
Well,
do you incorporate that?
I had a person that was, it's called a sponsor in the program, right? And this person, who happened to be an addict and a child of an addict, said one time that he'd been talking to his sponsor about those that go, as they call it in the program, go back out. Y'all will know what that means. I didn't really exactly too much, but they told me this. They said, they came to the conclusion, my sponsor said, is those that get the God thing get the program, and those that don't.
I couldn't agree with you more.
Okay.
You know, thank you so much.
You're welcome.
Boy, really blessed to have you on today.
It's been a privilege.
To my viewers, thank you for joining us today. I am so grateful to have had Dr. Rice here with us and given us this information. If you have any more questions or would like to talk to him, his phone number is area code 208-378-1122. And again, just as a reminder, there's nothing that without a higher power, God, you can't do. You know, I brought him into my life 35 years ago, and he's still with me one day at a time. And I don't do this by myself. I get the help of professionals and sponsors or whoever. That is self-abuse to try to do it alone. So if you have time and have some questions, give Dr. Rice a call. And thank you for joining me today. And don't give up, because your miracle's on its way.
Amen.
So I think we can cut out a little bit. You'll know what to cut out, because I want that ending.
That's part of the reason I have
That ending is